in your mind, I know that everything has to go through the whole public health authority, but for you, are there any indications that you would need in order to feel that you could recommend changes that would allow small gatherings for Christmas, for example? Would you say there has to be below 1 of that reproductivity rate, or is it something about the
it's a good question.
Rate?
We do not have a threshold at this time, and I think of course, we want to make sure that we all have a chance to celebrate Christmas. We're going to have some risk. We're going to take some risk at Christmas with those gatherings, but we have to calculate what kind of risk we're capable as a society to take, and what are we going to put after we take those risks of small gatherings to make sure that we do not introduce the virus in all our settings. So we're looking at how we can manage this and minimizing the risk of transmission after Christmas. We only started talking about it, so it's not we do not have a formula well established. I think, of course, we have to give something to make sure that the population will be able to celebrate or to have some form of celebration. We have to give enough to make sure that they won't just it's not an open bar for everyone. And of course, what we are looking at is more the measures that are going to be taken afterwards to make sure that if there is transmission, we do protect the most vulnerable. So of course, if we say yes to have family celebration, but you have an elder in your family that is really fragile, maybe it's not a good thing. So we're going to have different recommendations to reduce the risk for those that may have a severe form of the illness, and of course to make sure that we do not reintroduce, if there is more community transmission, that we do not reintroduce the virus afterwards in a different setting. And after, of course, we know what happens if we reintroduce it everywhere. It's going to spread easier.